Can malar mounds and eyelid festoons be treated? Welcome to Dr. Scheiner's Medical Minute. When we see one another, our brains scan the other person's face for nonverbal facial cues. We tend to focus on the eye and mouth region for these cues. When we see heavy upper lids or baggy lower lids in malar mounds and eyelid festoons, we tend to interpret that person as being tired, sick, and sometimes drunk. Malar mounds and eyelid festoons have been traditionally very difficult conditions to correct. And when lower eyelid surgery is performed without correcting the festoons and malar mounds, it often looks worse afterwards. This is because we expect heavy lower lids to accompany eyelid festoons and malar mounds, and when only one of these conditions is corrected, these festoons and malar mounds are accentuated and made to stand out in contrast. The best option is to correct the festoon, malar mounds, and lower lid bags at the same time. This gives the most beautiful and natural result. What are the options for treating malar mounds and eyelid festoons? Some options include attempting to stretch them out by making an incision above them and pulling upwards. This has mild and often disappointing results. Another option is to cut out the festoon and malar mounds, but this leaves a visible scar on this focal area of the face. Some have tried to put fillers around the festoon and malar mounds to blend the edges and make it less noticeable, but this tends to fix the festoons and malar mounds in a swollen mound when the desire should be to flatten these instead. My preferred option for dramatically improving eyelid festoons and malar mounds involves using lasers to tighten them from the outside in. This causes the mounds and festoons to flatten into the surrounding contour. Although this involves some recovery associated with healing, my patients prefer the results and don't mind spending time to get the results they seek. I hope you found this interesting and invite you to come back and watch again for our next Medical Minute. Goodbye for now, and I wish each of you a beautiful day.